Hi everybody, my name is Zoriatine and I wrote my paper about Down syndrome. With Down syndrome, it affects 1 in every 700 people globally, and there's 8.3 billion people, which is a lot. It is an extra chromosome that's built into the structure of their DNA. This does affect their whole lives, and their life expectancy is around 70 years. But although they can have a healthy, successful life, this will affect their facial features, their body proportions, their speech, their intellectual, and their functional abilities. Down syndrome affects the musculoskeletal system, such as the muscles in the neck and the back and the face, making this very difficult for speech production and activities for your daily living. Down syndrome is screened during the first trimester, equating to the first 10 to 13 weeks of pregnancy, and this is done with genetic counseling. The most common is trisomy 21, which is a chromosome 21. Instead of duplicating into 2, it duplicates into 3, and this happens within the cell division of the sperm and the egg. The least common is mosaic Down syndrome, affecting around 2% of cases. So when some cells in the body have an extra copy of the chromosome 21, it's a genetic factor, meaning if someone in the family has Down syndrome, there's a likelihood of the fetus developing it in the wound. And it doesn't necessarily have to be one of the mom or the father having Down syndrome. Parents are their small heads, their eye shapes are pointed inwards and upwards, a flattened nose, smaller nose, a wide mouth, with the tongue being visible. They also do call this the open mouth. Body features may differ between everyone, but most of the time it's a short neck, small hands, feet, a stocky built. This can also result in eye problems, speech problems, hearing loss, and one of the most common with Down syndrome community is heart problems. Often experience hearing loss and vision loss from birth. Some ways to accommodate are hearing aids and prescription glasses. Hearing loss plays a major role in development delay and difficulty communicating. This includes unable to hear themselves speak, not having control of their pitch, difficulties with their volume. This can also affect emotional regulation, leading to physical violence, tantrums, and screaming. People with Down syndrome also do have a lower IQ than the child their age. It's very common for children with Down syndrome to be growing at a slower pace, resulting in to be shorter than the average for their age. And during early learning stages, special attention and support must be provided in order for the child to be learning efficiently. Studies have shown it's a benefit for school-age child with Down syndrome to be on a sports team. Sports can give them a structure, social support, and being able to give them a teachable moment, and this can improve their emotional regulation. At this age as well, this is when, like everybody else, their identity is discovered. They get to figure out if they like their education and want to go to college or trade school, and they just need an extra little bit of support. The main goal from parents are for their child to be self-sufficient, independent as possible. Early interventions is the best way, and Down syndrome doesn't set them back. They just need patience, support, and guidance. Their speech is very limited. Down syndrome do not reach the same milestones, so they are considered delay as a kid of their own age. Down syndrome affects their phonology, vocabulary, articulation, sentence structure, social use of language, and have a difficult time communicating. Other affected is the loss of jaw muscles, which makes it difficult to speak. Their anatomy influencing the dry mouth from the open mouth, a really nasally speech, and a low pitch volume. They will also have trouble producing the letter K for k. Mostly any velar sounds from the improper buildup of pressure. Their swallowing is a combination of weak muscles and an open mouth. This makes the task very difficult. creates child to cough, drool, or have improper chewing and hypotonic tongue and lips. This can lead to unhealthy BMI and being overweight and malnourished. This, most of the time, parents will provide their child's comfort meals, and that will increase the meals. The teething are lower, and the current teeth are lower than the child's of their expected age. Intervention and prevention. Down syndrome will need many forms of intervention and prevention. Talk therapy for stabilizing medications for individual symptoms with violence or stubbornness. This may improve one's states of mind. Routine checkups at physicians and specialists are always needed to ensure everything is going smoothly. Occupational therapy for fine motor skills, and physical therapy for correcting posture, walking, and a potentially high BMI. A couple other that are also helpful are dietitians to make sure they're getting the right nutrition, routine visits at physicians, eye doctors, if they are using glasses, audiologists or ENTs for hearing if they have difficulty with hearing, and of course speech in order to communicate. And that was it. Thank you so much for watching.